Welcome back to the DRM News Podcast. We've got a heavy situation brewing down in Texas,
Yeah.
a measles outbreak that's sadly taken the life of a child.
You know, it's a harsh reminder that measles is not just a thing of the past.
Yeah.
This is the first U.S. measles death in a decade.
Wow.
And it really underscores the very real consequences of this preventable disease.
It's heartbreaking.
Yeah.
And what's got me scratching my head is where this outbreak started.
Mm-hmm.
You'd think it would be somewhere with, I don't know, poor health care or something, but it's not.
Right. This one's a bit of a curveball.
Yeah.
It originated in Gaines County, Texas,
Right.
which has a large Mennonite community.
Yeah.
They're known for being super health conscious, but there's a twist.
Okay, I'm intrigued. Lay it on me.
Well, they often homeschool their kids and keep pretty tight-knit socially.
Right.
And unfortunately, that's led to lower vaccination rates, making them vulnerable to something like measles.
So it's like their strong community ties, which are usually a good thing,
Yeah.
ended up working against them in this case.
Exactly. It created a perfect storm for the virus to spread.
Yeah.
And to make matters worse, it didn't stay put in Gaines County.
Oh, no.
It's now affecting 10 counties in Texas.
10 counties.
And even jumped over to New Mexico.
That's a wildfire.
Yeah.
And didn't I read something about it reaching San Antonio? That's a huge city miles away from Gaines County.
You're right.
Yeah.
We know that someone from Gaines County who was contagious traveled to San Antonio,
Wow.
which is a densely populated area.
Right.
So yeah, the potential for wider spread is definitely a concern.
This has me thinking about how contagious measles actually is.
Mm-hmm.
I mean, we all know it spreads easily, but how easy are we talking?
Measles is one of the most contagious diseases we know of.
Really?
Think about this. It can hang in the air for up to 2 hours
2 hours.
after an infected person has left the room.
Wow. So even if I just walk into a room where someone with measles was 2 hours ago, I could get it.
It's possible, especially if you're not vaccinated.
Right.
That's why the measles vaccine, the MMR shot, is so important. Yeah.
It offers robust, long-lasting protection.
Speaking of vaccination, I'm guessing most of the folks getting sick in this outbreak aren't vaccinated.
Sadly, yes. The majority of cases, especially among children, are in unvaccinated individuals.
Wow.
This outbreak really underscores how crucial vaccination is for preventing the spread of this potentially deadly disease.
And it all circles back to Gaines County, right? They have one of the highest rates of unvaccinated school kids in Texas.
Yeah.
It's tragic how this all connects.
It is. And it's not just Gaines County or Texas.
Right.
We've seen a dip in vaccination rates nationwide, especially since the COVID-19 pandemic. We're dropping below the 95% needed for herd immunity, which is a big problem.
So fewer people are getting vaccinated, which means less overall protection for everyone, especially those who can't get vaccinated for medical reasons.
Exactly. It leaves gaps in our defenses
Right.
and allows diseases like measles to make a comeback.
This outbreak is a stark reminder that measles can be seriously dangerous.
We've already talked about the child who died, and it sounds like there have been other severe cases as well.
Unfortunately, yes. While most people do recover, measles can lead to some pretty nasty complications,
Okay.
especially for young kids, pregnant women, and people with weakened immune systems.
What kind of complications are we talking about?
We're talking pneumonia,
What?
which is a lung infection, encephalitis,
Encephalitis.
which is swelling of the brain that can cause permanent damage,
Wow.
and even blindness.
That's terrifying.
Yeah.
And I think it's all preventable. Over 20 people have been hospitalized in Texas because of this outbreak.
And some of those hospitalized have needed serious help breathing.
Really?
This outbreak shows just how severe measles can be, even in otherwise healthy people.
The child's death, the first from measles in the U.S. since 2015, is a tragic wake-up call.
Yeah.
It underscores the need for vaccination to protect not only individuals, but entire communities.
It's a heartbreaking reminder that we can't afford to be complacent when it comes to preventable diseases like measles.
Now, this outbreak has gotten the attention of the government, with Robert F. Kennedy Jr., the U.S. Health and Human Services Secretary, addressing the issue.
Right.
What's been the government's response so far?
It's interesting because Kennedy has a history of being, let's say, skeptical of vaccines.
Oh, really?
But he has acknowledged the outbreak and said that the HHS is keeping tabs on the situation.
But I heard there were some issues with his initial statements, right?
Yes, there were a couple of hiccups.
Okay.
For example, he initially claimed 2 deaths
Oh, wow.
when there was only 1 confirmed at that time. He also suggested most hospitalizations were for quarantine,
Really?
which frontline medical professionals disputed.
So it sounds like there might be some confusion or maybe misinformation floating around about the outbreak.
That's possible. It's crucial to get your information from reliable sources,
Right.
like the CDC or your local health department to get the most accurate picture.
And what about the HHS's role in containing the outbreak? Are they taking any concrete steps?
The HHS has said that the Texas Department of State Health Services is taking the lead.
Okay.
So it's a localized approach.
Okay.
However, they are providing support with vaccines, technical assistance, and lab support.
So a collaborative effort between federal and state agencies.
Right.
What about on the local level? Is there anything happening there?
Definitely. The Lubbock Health Department, for instance, has been proactive in promoting the MMR vaccine and offering free vaccination clinics.
It's great.
They're also working to educate the public about the importance of vaccination and address any concerns.
Those local efforts are so important for reaching people who might be hesitant about vaccination.
Right.
It sounds like a multi-pronged approach is needed to tackle this outbreak and prevent future ones.
Absolutely. It's going to take a combination of effective public health measures, clear communication from trusted sources, and community involvement to combat measles and protect vulnerable populations. You know, this whole situation really throws a spotlight on the whole issue of vaccine hesitancy.
It's a tangled web, for sure. Not an easy thing to untangle.
Right. And when you zoom out and look at the bigger picture,
Yeah.
it's clear that vaccine hesitancy isn't just a personal choice.
Right.
It has serious public health implications, as we're seeing right now in Texas.
It's like this virus is spreading on two fronts. The actual measles virus and the virus of misinformation.
Mm-hmm.
We have a safe and effective vaccine.
Right.
But there's still resistance to it.
It's mind-boggling, isn't it? It shows how potent misinformation can be.
Yeah.
Especially with social media acting as a megaphone for false claims and conspiracy theories.
It's like fighting a two-headed monster, measles and misinformation.
That's a great analogy.
Yeah.
And it highlights how urgent it is that we tackle vaccine hesitancy head on.
Mm-hmm.
We need to dig down to the root causes, address people's concerns with empathy and evidence, and rebuild trust in scientific institutions.
I'm with you on that. It's not about pointing fingers or judging folks who are hesitant.
Right.
It's about having real conversations, acknowledging their fears, and giving them accurate information so they can make informed choices for themselves and their families.
Exactly. And it's important to remember that vaccine hesitancy isn't a one-size-fits-all thing.
Right.
People have different reasons for being hesitant.
Yeah.
Some are worried about safety or side effects. Others have religious beliefs.
Right.
Or distrust the government or pharmaceutical companies.
So a cookie-cutter approach won't work.
Right.
We need strategies that address the specific concerns of different groups.
Absolutely. And that requires teamwork, healthcare providers, public health officials, community leaders, even social media platforms.
Wow.
All need to work together to combat misinformation and promote accurate information about vaccines.
We're all in this together when it comes to public health.
And you know, something that often gets lost in this discussion is the issue of access.
Access to vaccines.
Exactly. For some people, it's not about being hesitant.
Right.
It's about facing obstacles and getting the vaccine. Maybe it's the cost, transportation, or just not knowing where to go.
That's a crucial point.
Yeah.
We need to make sure everyone can get vaccinated easily and affordably.
Right.
Regardless of their income or where they live.
Couldn't agree more. Equity is a cornerstone of public health.
Yeah.
We need to address those systemic barriers so everyone has equal opportunity for protection.
Speaking of access, what role does the government play in all of this?
The government has a big role to play in tackling vaccine hesitancy and making sure everyone has access to vaccines.
Okay.
This means funding public health campaigns to spread accurate information, supporting research to address safety concerns, and making vaccines affordable and accessible to everyone.
Sounds like the government needs a multi-pronged approach, too.
For sure. And it's important to note that this isn't just a U.S. problem.
Real.
Vaccine hesitancy is a global challenge.
Wow.
The World Health Organization has even flagged it as one of the top 10 threats to global health.
Wow, that's serious.
Yeah.
So this is something that demands international cooperation and collaboration.
You got it.
Yeah.
You need to share what works, support countries with weaker healthcare systems, and join forces to fight misinformation.
This conversation has really opened my eyes to the complexities of vaccine hesitancy. It's obviously a multifaceted issue with wide-ranging implications.
It is. And it reminds us that public health isn't just about medicine and science. It's about trust communication and addressing the social and economic factors that impact people's health.
Before we move on, I want to take a moment to acknowledge the fear and uncertainty that many people are feeling right now.
It's completely understandable. People are worried.
Yeah.
Especially with news of a child dying from measles.
It's a tragedy.
Yeah.
And it highlights the real dangers of this disease.
Right.
But it's important to remember that we have the power to protect ourselves and our communities.
You're absolutely right. Vaccination is our strongest weapon against measles. It's safe, effective, and it saves lives.
We'll be back to delve into the broader implications of this outbreak and explore what we can learn from it. We're back, and I'm thinking about the bigger picture now. What lessons can we take away from this outbreak, and how do we prevent something like this from happening again?
This outbreak is a reality check.
Yeah.
It shows us how fragile our progress in public health can be. We've made huge strides against infectious diseases with vaccines.
Right.
But if we don't keep those vaccination rates high, we can lose ground fast.
So we can't afford to get complacent.
Exactly. We need to be on our toes and proactive.
Okay.
That means strengthening our public health system, investing in vaccine research and development, and tackling the root causes of vaccine hesitancy.
And I imagine that also involves getting better at communicating with people.
Yeah.
Making sure accurate and reliable information about vaccines reaches those who need it most.
Absolutely. We need to fight misinformation with solid evidence.
Right.
Engage with communities in a respectful and culturally sensitive way. And rebuild trust in science and healthcare providers.
It sounds like we need a multi-pronged attack, one that tackles both the science and the social factors driving vaccine hesitancy.
You hit the nail on the head.
Okay.
And it's important to remember that vaccines aren't just about protecting yourself.
Right.
It's about protecting your community, too.
Yeah.
Especially those who are most vulnerable, like babies and people with compromised immune systems.
That brings us back to herd immunity. A high vaccination rate creates a safety net for those who can't get vaccinated for medical reasons.
Precisely. Vaccination is a shared responsibility. It's a way for us to protect each other and build a healthier future for everyone.
This outbreak has been a wake-up call, for sure. It's shown us how vital vaccination is and how challenging it can be to maintain public trust in vaccines. It's a complex issue with no easy answers.
That's true, but I'm still hopeful. We have the knowledge, the tools, and the collective will to overcome these challenges. If we work together, we can create a future where preventable diseases like measles are just a bad memory.
This has been an incredibly insightful conversation. Thank you so much for sharing your expertise with us today.
It's been my pleasure. I encourage everyone to stay informed, have open and honest conversations, and make informed decisions about their health and the health of their communities.
And to all our listeners, we urge you to seek out trustworthy information about vaccines from sources like the CDC and your local health department. Your health and the health of your community depend on it. This is the DRM News Podcast, signing off.